going to do the comprehensive shoulder examination. First of all, take note of looking at the shoulder joint and the counter of the joint and the symmetry, and check for is there any skin lesions, the counter of the skin, any tenderness. Then examine from the side, look for any AC joint deformity or subluxation. Then inspect from the back side. Now, starting first, check the temperature of the clavicle, symmetry, feel for the coracoid process, check for the AC joint, is there any tenderness in the joint? Check for the symmetry. Then, can you please move backwards? Okay, thank you. Now, from the back side, from the border of the scapula, continue inspecting, palpate, and find the medial border of the scapula. Find the tenderness of the supraspinatus and the infraspinatus muscles. Check for any deformity like winged scapula. Now, ask the patient to push the wall. Sir, can you please push the wall for me? When you push the wall, find is there any winged scapula. Scapula is like it may be falling down in the symmetry. None is found here. Thank you. Now we are going to do the crossover test. In this test, ask the patient to flex the hand 90 degrees and abduct horizontally. If the patient has any AC joint problem, there will be pain on the top of the shoulder. If doing like this produces pain here if the patient has AC joint problem. Now we are going to do the aptly scratch test. In this test, ask the patient to catch the back pocket with one hand from upside and one hand from downside like this. Then ask the patient to do the same with another hand. Then you will find the dominant hand will be free in doing, but the non-dominant hand will show some rigidity. Sir, can you please do like this? Can you please switch the hand and do with another hand now? Now you can see the dominant hand easily catch the two hands nearly like this, but the non-dominant hand shows some rigidity like this. They can't be completely close together. Now we are going to do the near test. This is generally used to assess the subacromial pain syndrome. In this test, keep one of your hand on the scapula of the patient to support. Then bring the arm to the maximal flexion passively with your force. You bring his hand to 90 degrees of flexion. maximum flexion. So if patient is having that syndrome, he will feel the pain on flexion. Now we are going to perform the Hawking Kennedy test. In this test, with your one hand support the scapula, then ask the patient to flex his arm to 90 degrees and the elbow also to 90 degrees. And with your another hand, hold the elbow, then passively rotate into the glenohumeral joint. If it is the normal position, rotate into passively like this into glenohumeral joint. If the patient is having problem, he will have pain. We are going to perform the drop arm test. Make the patient in a standing position first of all. Then ask the patient to abduct the hand to 90 degrees. Then with your both hands, hold the patient hands. Then if you remove your hands like this, if the patient have the capacity to control the downward movement like this, in this way, if he is able to hold his hand in this way, even I remove my hands, then the test is negative. If the patient has tear in supraspinatus and infraspinatus muscles, then the scenario will be like this. So when I remove my hands, the patient will drop his arm like this. This is the positive test. Now we are going to do empty can test. In this test, patient should be in a standing or sitting position and then ask the patient to follow your instructions. Sir, can you please follow my instruction? Flex your arm 90 degrees in the scapular plane and then internally rotate your arm. After this, you keep the resistance on the patient hand and ask to resist the downward force. So, if the patient is able to do this, there is no problem. And if test is positive, there will be weakness in resisting the downward pressure applied by the examiner. Now, we are going to do complete hand and wrist examination. First, ask the patient to pronate his hands. Then, check for any asymmetry or any muscle wasting, any bruise, or any tingling sensation problems, or any jerking movement of any finger. So, after that, check the temperature. Then ask the patient to rotate his hands supinate. Now check any muscle wasting again in the counter of the thenar and hypothenar muscles. Again check the temperature. Now check the radial pulse of the both hands. Ask the patient to flex his elbows. Sir, can you please flex your elbows? Fine. Thank you. Again ask the patient to keep the hands. Sir, can you please rotate your hands like this? Then check the joints. Metacarpal joint and interphalangeal joints of the each finger. Check is there any swelling between the joints, in the pain when you are palpating. Do the same on the another. Now ask the patient to squeeze your both fingers to check the strength, gripping strength of the hands. Thank you, sir. Now we are going to do the finger steam test. In this test, rest the hand of the patient, the ulnar side down, and in first step, ask the patient to rotate his hand slightly. Enough. If it produces pain, the test is positive. After that, you passively rotate the hand of the patient like this. In this case, if again it produces the pain, then it is positive. In third step, just hold the finger of the patient and flex it medially. Rotate it into like this. If it produces the pain, the test is positive. We are going to do the carpal phalanx test. It is useful to assess the carpal tunnel syndrome. In this test, ask the patient to flex his wrist dorsally and hold like this for 1 minute. Sir, can you please flex your wrist dorsally and hold for 1 minute? If patient is having the problem, carpal tunnel syndrome, there will be the tingling sensation in the thumb. Now, we are going to do the Tinel test. This test is also used for assessment of carpal tunnel syndrome. In this test, tap at the carpal tunnel. Then, after that, tap from the index finger to the elbow. If test is positive, there will be tingling sensation or paresthesia in the thumb. Now, we are going to do the thumb abduction test. First, ask the patient to flex his wrist and with one of your hand, hold the hand of the patient and then continue to apply the force on the thumb. Force on the thumb. In this, actually, thumb should abduct like this. When we apply the force, if the thumb resists our force, then it is negative. The test is negative. If the patient is unable to hold or resist the force, then the test will be positive. Now we are going to do the knee examination. Check the bulk of the quadriceps muscles, any knee deformities, any swelling in the knee, and the skin counter. Now from the side, check the flexion. Sir, can you please flex your leg? Yeah. Check the flexion, then the foot arches, and any toe deformity. Now, from the back side, check the iliac crest alignment, bulk of the gluteus muscles, any swelling in the popliteal region, and the hindfoot abnormalities. Fine. Now, check for the knee tendon reflex. Generally, do it below the knee at the line here. When you hit with the hammer below the knee in this region, you can see the reflex. Now, we are going to do effusion bulge sign. So in this test, ask the patient to lie supine and legs extended and relaxed. First, from the medial vesicles, displace the fluid. Then from the suprapatellar pouch, displace towards the lateral vesicles. This is to displace some more fluid from medial side. After doing this, there will be an appearance of bulge here. Now we are going to do the patellar tap test. First, if the patient is lying supine in leg extended and relaxed, then stroke downwards from the thigh till the suprapatellar pouch and press downwards. And do the same from here also till you reach the tip of the patella. Then with one of your finger palpate the patella, check whether it is floating or not. Now we are going to do McMurray test to check the damage of meniscus. So to do this test, first hold the leg of the patient and keep one of your hands just below the popliteus, and then flex the leg and rotate the tibia medially and extend it several times in different angles to check the posterior lateral meniscus. To check the medial meniscus, flex this leg in the same way, then rotate the tibia laterally and extend the leg. Now we are going to do valgus cross test to check the medial collateral ligament injury. For this test, hold the ankle with one hand and keep one hand around the knee at the head of the tibia. And now try to push the ankle laterally and the knee medially. Try to open the knee joint. Now we are going to do varus cross test. This test is to assess the lateral collateral ligament injury. In this test, grab the lower leg with one hand and with one more hand keep on the femur and rotate the leg medially and apply the force with this hand here. Now we are going to do the anterior drawer test. This is for to assess the anterior cruciate ligament injury. In this test, first ask the patient to slightly flex his leg and then sit on the foot of the patient and keep your both hands at the head of the tibia. Now move the tibia explosively out in a jerking movement. The test is positive if the tibia moves forward more than 6 millimeters. with one of your hand, then with one other hand rotate the tibia externally and then translate tibia forward. Now we are going to do posterior drawer test. In this position, ask the patient to flex his leg and fixate this position by sitting on the foot of the patient. Then keep your both hands at the head of the tibia. Then push the tibia explosively backward. If tibia moves backwards more than 6 mm, the test is positive.